This is probably a question that you get a lot, but what can make you stand out as a candidate for orthopaedic surgery?
Orthopaedics is pretty popular, and I get this question quite a lot. Often we have exposure to trainees both from the medical student level all the way through their training, internship, RMO, and then unaccredited positions. So identifying that you're interested in it early is often the first step to being noticed and being considered for the program. There are often several opportunities that tend to present themselves throughout that continuum. Research is a really good opportunity to learn the process by which we as orthopaedic surgeons think in terms of assessing the validity of a treatment and then determining whether or not this is something that we want to work out in our practice. Critical evaluation of both the literature and our outcomes is integral to improving both our surgical outcomes and patient outcomes. And so understanding that whole process from the ground up through research is a really good way of learning that process. Having the opportunity to work on an orthopaedic ward, both as a medical student, as an intern, and as a RMO is also a really good way of learning what the work involves, because essentially we're carpenters of the body. The only difference being that if you likened it to a car, the car's running the whole time that we're performing our procedures. So all of those things need to be taken into consideration when you're performing the art of orthopaedics, but having as much exposure as you can at each of those time points and getting in front of it, understanding it, immersing yourself in the culture and in the work will lead you to determine whether or not this is something that you want to do for a long time. Because as a medical student, you've got plenty of time to pick and choose what you're enthusiastic about and what drives you, and having a good understanding about the workload, the patient cohort, the outcomes that you can expect is a really good baseline for making that ultimate decision if orthopaedic surgery is right for you.
Great, thanks James.